Hello and welcome to the respiratory assessment video for Nurse 214. I wanted to start off with some basics about the respiratory system that you've seen before. First, we'll be looking at a photo of the conducting airways in the respiratory unit and how we start large and end up very small and fine. I'm certain you've seen this photo before and you've discussed it in your health assessment class, but it's always good to have a refresher. You can see as the tree branches out more and more, it gets definitely more fine, and as you get all the way down to the alveoli, that's where the gas exchange happens in the body. In this picture, you can see that the alveoli at the top are very enlarged, expanded, as they should be, and they look healthy. On the bottom section, you can see that they are more collapsed and compressed, and this is an example of atelectasis, which we always hope we don't have in our patients and what we are trying to avoid. I'm going to show you a picture of the alveolus, and this is a close-up view of what actually happens with the exchange of gas in the lung tissue with the capillaries. You should go back into your text or refer back to former instruction in your A&P class if you need a more in-depth refresher. This next photo will show you a outline of what the lungs look like inside the body, and of course you can see the little bump there in the center where the heart would be. Right upper, left lower, right middle, right lower. And now we're going to talk about where you would be auscultating when you assess your patient. On this anterior view, you're going to have your separate sections, and you're going to have 8 assessment points. 1, 2, 3, 4, 5, 6, 7, and 8. When you go to the back side of the patient, now you can see the outlines of the left upper, right lower, left lower lobes. And you also have multiple assessment points here as well, as you may recall from your other classes. 1, 2, 3, 4, 5, 6, 7, 8, 9, and 10, because of course our lungs are longer in the back and you have more to listen to. The next picture shows the right side of the body, the lateral view, right upper lobe, right middle lobe, and right lower lobe of the lung. And on this one side, if you're looking in your Silvestri review, you will see it's separated from left and right side. So for this side, it would just be the number 1, number 3, number 5, and number 7 sections. Now that you've had the opportunity to see the auscultation points, I wanted to show you an embedded video that will review lung sounds. In this section of the video, I wanted to talk to you about what you would see in Epic, which is the platform that we use at the Christ. On your screen, you're going to see a mock-up of a patient. It's in the playground portion of Epic, so this is not a real patient. Under the respiratory assessment section, under the complete assessment, you can make that expand so you can see more options. And I just wanted you to see all of the possibilities in Epic as far as what could be documented. If you'd use WDL within defined limits, your patient needs to meet all of these criteria, which very few patients do in the hospital. So you would use the X when documenting. Then you can go through and look at all of the options. The pattern of respirations, options here on the side for you. The actual chest assessment, how things look. Yes or no on the crepitus, location. And then we go into breath sounds, which is actually what we're focusing on in this section. It's a very basic list for you on this portion under respiratory. If you want to get into more detail, you can go down a little farther where it says localized breath sounds, and this would offer you a little bit more of an expansion and description as far as using the terms fine crackles and coarse crackles, just a little bit more to work with. The only other thing you can't see here is just other, where if you aren't pleased with your selections or if you find something unique or unusual, you can add that in as a comment as well. All of the options are the same for each of these. So I just wanted to give you a little quick look in Epic at what you might be seeing when you document on your patient. Under cough, which is also under the respiratory section, here you're going to see the breakout of row information over to the side. And then up above, you'll be able to see the multiple options that are available to you when you're documenting in the EMR. At our facility connected to the college, we do use Epic, so these are the options available here. Again, the other option is available if you do not like what you're seeing on the screen. I wanted to thank you for listening and going through this new screencast with me. Remember to use your text, evolve, and Silvestri, replay as needed, and this was intended to be just the basics.